was there any splints that were put here? Because like I was feeling a lot of stress here and I'm doing my best to avoid pressing anything. But there's this constant feeling that something might come off or something. Like I'm just a little bit scared that if I do something, something will go wrong.
No,
So
there was no splint put in your case. It was a suture mainly. So we suture it. That's the reason you feel like it is stiff in this part mainly.
Yeah.
And also, what happens during the healing process, the body will help you more and more. Any injury, the body will be hyperactive in that area.
Yeah.
So more of secretions happen and the mucus collection happens.
Mm-hmm.
So you feel stuffy and stiff over there due to dryness.
okay. And you took a lot of these things in the cleaning process, right? Like, can I expect that to continue happening for a few more days?
Yes, you can expect, but the intensity will be less and also the content will be less.
Okay.
Day 1, day 2, day 3 will be little more.
Okay.
As the healing process starts, maybe start with the nasal irrigation.
Okay.
So those crust formation, we call it as coagulum, hemocoagulum.
Okay.
So that content will go on reducing.
Okay. I don't have to be concerned about that. What sort of activities? I mean, I know I'm not going to do any workouts or anything during this time, but I'm not even going to bend all of that. But what would you say, like, don't do this, like, keep this in mind while you're going ahead with your day-to-day activities?
See, regular day-to-day activities, even laptop or desktop work you can do, even the kitchen work you can do,
Okay.
household regular work you can do,
Okay.
but avoid dusting and cleaning by yourself,
Okay.
the mopping,
Okay.
and avoid lifting heavy weights more than 6 kgs.
Okay.
And if you have to lift anything from the floor, so don't bend yourself completely.
Okay.
So sit, then you lift it up.
Okay.
So these are the precautions.
And
Even walking is fine, even riding bike is fine, riding
Really?
car is fine. Yeah, yeah.
okay. And when it comes to eating, I can't drink hot or cold, but there's no other restriction apart from I can drink like soft drinks, pastries, cakes, and all of those things.
That I would have explained it to you. No Maida items.
No Maida.
And avoid carbonated drinks as much as possible.
Okay.
Because since you're taking the medicines,
Mhm.
we don't want the biosystem in the gut to get disturbed with the other
Okay.
things like carbonated drinks.
Okay. If I'm feeling congested in my nose while I'm sleeping and all of those things, is it okay? Like
Yes.
I don't have.
Yes, you just open your mouth and breathe. And since we are starting the irrigation to the nose, even that will come down.
Okay.
What you can expect is once you start the irrigation, little bit of chocolate brown chunks you might get from the nose during the irrigation or from the mouth.
Okay.
It is common, you can expect for next 2 to 3 weeks.
And when I'm using the irrigation, I don't have to be afraid of putting too much pressure or anything.
Yes, yes. Simple thing, give minimal pressure.
Minimal pressure.
That's it.
Okay.
Minimal pressure. Your body only will teach you.
Okay.
Like you will sense, okay, what is maximum pressure.
Okay.
Because once you put the more pressure, you feel little discomfort inside.
Yeah.
And since we have done the complete sinus surgery, we'll start experiencing the water irrigation into the sinuses.
Yeah. And if it starts burning, what can I do?
This solution, it won't burn. No
Okay.
need to worry.
Okay.
Definitely it won't burn.